Welcome, everybody. Hello, and welcome to another Community Fit, and in particular, a midweek desk stretch. I'm your host, James, here with Lazy Dog Bob, right here, bringing you a class all on embodiment, and in particular, working with spine, back, the core for this 6 week period. Okay, for those of you who've been with us for a while, you know the drill. You know what to expect. For those of us that are new here, here's how the class rolls. We're going to start off with a little nervous system regulation work. If you have a nervous system regulation practice that you like to do, something that calms, grounds, makes you present, feel free to do that. It might be a meditation, it might be a breath work, it might be whatever it is you need. If you have no idea what a nervous system regulation practice is, follow mine along. And if you want to know more about nervous system regulation, join us on Fridays for Adjusting to Change Toolkit, where that class is all about nervous system regulation. So learn more there, practice it a bit here, and then we're going to move into some spinal stuff. Last week, we covered kind of mid to upper back, specifically through the lens of breath work. Today, we're going to kind of concentrate, we're going to cover a few different things, but we're going to concentrate on some low spine, low back stuff because that's where a lot of us carry tension and stress and pain in. So that's where we're going today. And we're going to do it through possibly a surprising way for some people. And we'll talk about that when we get there. So if you have low back stuff or you know someone who's got low back stuff, this is probably going to be the class for you. But we're going to kind of expand and move all over the place today. So get comfortable, and we're going to start off with our nervous system regulation work. We've got about 3 to 5 minutes, so do what you need to do here. I'm going to start off with a breathwork practice. The breathwork practice I'm going to choose to do today is like a resetting breathwork practice, and it's relatively simple. What you're going to do is take a inhale, hold your breath, and you're going to hold your breath for as long as you can, and even a little longer than what you think you can. It should be mildly uncomfortable. So I'm holding, 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 holding. When you're done holding, exhale. Exhale more. Exhale all of the air out, and then close your mouth and hold your breath. And it's going to get uncomfortable. And I'm not asking you to get so uncomfortable that it hurts, but mildly uncomfortable. Holding, holding, holding. When you feel you can't hold it anymore, let your body almost gasp in air. Hold. Hold, 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 hold. Exhale, 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 exhale. Hold, 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 hold. Got it? So it's an inhale and an exhale. The inhale will almost be reflexive. And then I can't tell you how long to hold your breath because everybody's different. Your job is to do 2 or 3 of those starting now, or whatever nervous system regulation work you prefer to do. And then just finish up whatever cycle you're on. And for those of you who are finished, bring your hands together, get them warmed. Maybe it's on your chest, the jaw, wherever warm hands would feel good. Just begin to rock right and left. Maybe you even want to close your eyes. And just do a little inhale, exhale. Inhale through the nose, exhale through the mouth. Just feel a little bit of rocking, a little bit of weight and warmth. Another 10 seconds. And release. Okay. So again, we're going to concentrate a lot on like middle to low back area, but we're going to start up top. Bring your hands together, get them warmed, and we're going to take our warm fingertips and we're going to place them at the top of the neck, base of the skull. And once there, it's just little tiny circles. And we're going to let our head kind of fall back or to the left or to the right, just guided by what feels good. And as you do this, real soft touch, right? On a scale of 1 to 10, pushing in, I'm pushing in at about a 2, right? So it's a relatively mild touch. I am going to simultaneously begin to think about how can I let my right and my left sit bone, like the bones underneath my butt cheeks, feel as if they relax, widen, let go, yield. It's just how much more can I sink into and widen into whatever it is I'm sitting on as I do this. Another 15 seconds, continually releasing, widening, relaxing. And then we're going to have our right hand go on the left side of the throat. Big, heavy hand draws to middle as I twist my face in the opposite direction. Left hand, right side of the throat. Big, heavy hand draws to middle as I twist. Big, heavy hand. Big, heavy hand. One more each side. Big, heavy hand. Big, heavy hand. And then take both fingertips, sets of fingertips, and just do a little jaw massage. Just kind of real soft circles. And maybe even as you do that, your mouth just gently opens and gently closes. The whole time just widening, releasing, relaxing, as if your pelvis just got a little wider, a little deeper, sinking a little more into whatever chair you're sitting on. And then relax. And just notice any differences from the top to the bottom, like what might feel different. And as always with this class, remembering the 1 or 2 or 5 things that felt really important for you to remember from today, and just recalling those, creating a little library, things that are hard for you or things that felt really, really good. Now, working on the upper portion kind of has a reflective quality down below, meaning it primes hips, low back area to do some deeper release work, especially for area like when it gets really tense and really tight. A word of encouragement is to not go in and like poke and prod and force into relaxation, but start elsewhere. Do a little relaxation, do a little nervous system technique elsewhere so that the totality of your nervous system has a, oh, I feel good moment before we go in and like work in some areas. Now, I'm going to adjust my camera here because as we've talked time and time and time again, a lot of our low back stuff is actually coming from hips. So we're going to work hips first. Right there's probably good. Okay. Coming to the front edge of whatever chair you're on, my feet are about hip distance apart. And I'm just going to start to swing legs open and close. For those of you who've joined us for a while now, you know that this is one of our like hip and shoulder release techniques. So we're just doing like a real casual floppy action. Now, people always ask, what are my feet doing? My feet are kind of flat on the ground and pointed forward. They're not glued to the ground, but they're not floppy, right? They're kind of like subtly allowed to move. So we're not being strict on keeping them down, but we're not neglecting them and letting them flop all over the place. Just kind of getting some movement through the hips. Especially if you have SI joint pain or like low back going into the glute pain, stuff like this is really, really beneficial. Then I'm going to pause and I'm just going to rock right butt cheek to left butt cheek. And I'm going to feel into right sit bone and left sit bone. Right sit bone. Hi, Bob. Left sit bone. Almost as if I'm doing like a compression massage, right? It's like I want to feel beyond the meat of the butt cheek and go deeper into the bone. It's like I'm feeling into that. So having a firmer chair is often more helpful here. Last 4, 3, 2, 1. Then I'm going to take one leg and kind of cross it over here. Now, as always, if you don't have this level of flexibility here, like your leg can be down a bit, it can be up on something. It doesn't have to be here. But I'm going to ask that you kind of sense or feel into those sit bones that we've been working with. Can you allow them to be wide, relaxed, yielded, and let go of? And can you feel both of them relatively equally weighted on the chair? Meaning that I'm not crossing my leg and kind of veering over. I'm sitting up straight, more or less. So where can your leg crisscross over in a way that allows you to sit up straight? And then I'm going to rock forward and back to get a little mobility work in this hip. Last 4, 3, 2, 1. Set that leg down, and then let's pick the other side up. And we're going to acknowledge that this side is probably different. This side for me is tighter. We're going to go into the rocking. So you may need to change the setup. This leg may need to go somewhere else. Last 5, 4, 3, 2, and 1. Setting it down, going back into like floppy legs, and just noticing any change here. For me, it feels like they can go a little wider, a little easier. And then instead of open and closed, it's like they're just going to kind of jiggle in place, right? It's almost like a restless leg, nervous leg thing. Maybe feeling and sensing into the feet a bit. And release. Now, from there, kind of sitting back a bit, feet more or less on the ground, I want to imagine I'm doing like a hula hoop action, maybe somewhere below my belly button. Now, it doesn't have to be perfect, but I want you to notice the quality of motion and where you're moving through. So exercises like this might be really beneficial to practice in front of a mirror. because you'd be surprised. A lot of people think they're doing what I'm doing, which is kind of moving through this area, right? And instead, they're moving like up here, and nothing here is moving. Or they're moving here, which is kind of moving through the pelvis. Want it to be like movement below the rib cage, above the pelvis, more or less, and then reverse. Like we're really trying to convince or coax or do movement in the lowest portion of the back, which is usually easier said than done for a lot of people. And then instead, hold still. Now we're going to just rock the pelvis forward and back, which is different than sending ribs forward and back. So again, there's an element of mindfulness that comes into some of this. Hula hoop can be easier standing, but it doesn't have to be, right? You can kind of practice wherever it is. Now, that's some of our bigger movement there. I said at the top of the hour here, top of the half hour here, that we would be working on our low back, maybe from a surprising angle. And the way we're going to concentrate on kind of releasing some of our low back stuff is actually through the front. Typically, most of us have a mental image of our body that is either like, this is me in the front, and this is what I imagine I look like in the back, and things in my spine or in my back belong on the back side, and the things that are in the front belong on the front side, and things that are in the legs belong to the legs, and things that. And instead, the invitation here is to think of yourself as a total organism or a total system. And a very easy visual for me is like a car. So I can take and segment my car into tires and an engine and like seats inside and brake systems and a foot pedal, so on and so forth. But if I remove a tire, is my car still totally fine? If I have a flat tire, is my car totally fine? Is the rest of my car totally fine? Can I use the car in the same way? The answer for most of us is probably not. And yet we do that to our body all the time. We'll think, oh, it's just a foot thing, or oh, I'm great except for my shoulder. And that's the first level of kind of inviting in like a different way of looking at your body. And maybe it's the first time you've ever looked at it as a total ecosystem, an organism, a constellation. And in the same way, if I'm having issues, pain, tightness, tension in my back, I want to invite you to realize that your spine is actually not on the backside of your body. It is more or less in the center of your body. And in front of that spine, you have things like intestines, and you have things like a stomach and a liver and spleen. And on the backside of it, you've got things that are like kidneys, and you've got psoas muscles that kind of go from the backside to the front side that join ribs into legs. And that's my way of just kind of saying, like, if we are having back issues, it could be inflammation going on in the gut or in the belly. It could be movement that is not happening in the psoas or the muscle system or in the connective tissue in the front. And so sometimes poking, prodding, pushing on areas that feel like they are the pain points is actually not the best way to attack discomfort. And so we started up here and down below to really work on our back. And now we're going to kind of address the front. Those of you who have been with us in for the long haul have seen a similar routine in our nervous system regulation classes, because a lot of our nervous system dysregulation, specifically around shame, trauma, relational stress, is embodied, and even more so for women, is embodied between the pelvis and the rib cage. So kind of in the gut area. So we're going to kind of work on this, and it's a twofer. We're really working on this area, and it will have some nervous system regulation components to it. and simultaneously has the capacity of releasing and unraveling some of our low back stuff. And here's what we're going to do. You're going to kind of sit back, and you may now want to be in a more comfy chair. You may want to be on a couch or lying down. So we're going to take and warm our hands up. And we're going to take and place said warm hands at the top of the belly, kind of underneath rib cage, like directly where your anatomical stomach is. Stomach is not down here, stomach is more up here. And we're going to hold that, and we're going to kind of push into our bodies. On a scale of 1 to 10, we're pushing towards our bodies, into our bodies at about a 3. So it's noticeable, but it's light. And then, and I'm always moving in this direction, I'm at the top. This is my left. I'm moving both hands to the left, down, below the belly button, to the right, up to where I started. Repeating, left, down. This is the direction of peristalsis, or the movement of your gut and the way it processes food for the body. And so we're moving in the anatomical direction. And we're just going to kind of move around. Now, as you do this, the more sensitive you become, you're going to find areas of importance to pause at. And I say areas of importance because for some people, it will feel exceptionally good. For some people, it will feel exceptionally bad. For some people, it may just feel interesting or curious. Like, that feels different over there. Like, for me, it's right here. And I'm just going to pause right here. And I'm just going to take a couple of breaths. And maybe while I do that, I again think about releasing, widening my sit bones. Maybe I want to do a little supple, soft neck movement. And I'm just going to breathe into that. And once I'm here, and after a while, it's going to feel less important to be here, right? It's going to feel like, okay, I can move on. And maybe there's another area of importance. Like for me, it's right here. And this is what I'll tell you. As I do this, when I was doing the hula hoop exercise, I noticed that my left SI joint, and this is my left side over here, my left SI joint, sacroiliac joint, low back pelvis area, felt mildly inflamed. It felt like, oh, that feels different. It didn't hurt. I didn't go like, oh, I shouldn't do this. But I was more aware of it than I should be. And then I move here and it's like, oh, this is kind of psoas, connective tissue, left gut area. And this feels very important. And so in walking you through my experience, I would go, I wonder if my SI joint is causing some belly stuff over here, or I wonder if some belly stuff is causing some SI joint stuff. Regardless, there's a relationship. And so working on one will work on both. So I'm going to just spend some time here and maybe now doing a little bit of a gentle massage. You've likely moved on to another area. When you feel ready, you can move on, whatever that means for you. You can just kind of move through that. Now, if I was really therapeutically working on myself, I might do this longer. I might have paused somewhere more, but this is a class. So I just got to kind of give you some techniques. After this, I'm going to sit up and I'm just going to evaluate, like, how did that affect my low back or pelvis? Like, what do I notice now? And if I'm going to walk you through my experience, I didn't even work on my low back, but my low back feels wider. It feels, it's like my map in my brain is like more aware of my low back, which is a good sign. Then I'm going to go back in. Now I can continue to do that, or I can kind of take and put my fingers instead of like a triangle. It's like I'm going to make a V with it. I'm going to take that V and kind of push it into my stomach here. And again, I am not pushing deep or hard here. I am not stimulating anything. It's just like an awareness. I'm going to push here and I'm going to push in and out, maybe at a 1 to a 3 level depth. And it's going to look like this. And then I can move same circular fashion. And for some people, this might be too much. You may want to go back to the hold or the like circular action. And you'll probably notice I'm pausing where it feels important to pause. And Bob's doing a wave at everybody. And then I can go back to just some soft movement. And then I can do another evaluation, right? And I can do the evaluation from just a felt sense. Does that feel better? Or I can do a little movement test. Do things move better? Just do a little side to side. And then I'm going to go back in. Now, we kind of did a circle around it. Now I'm going to go right into my belly button. I can either just kind of do a little hold, or I can do that kind of pulsating action. And you're going to notice that at first your belly like wants to tense and tighten against it. The goal is going to be how soft, supple, and relaxed can I be. And we're not going deep. This is like an inch in and out at most, a pressure of between 1 and 3 out of 10. So it's not a lot, but it is noticeable. A couple more breaths. Another 5-10 seconds. And release. Now, I'm going to move forward for this. So from there, what we're going to focus on now is kind of some pelvic floor, which is so essential to low back and pelvic health, and something that is culturally often uncomfortable to talk about because we're talking about pelvic stuff. And I'm going to use some language here that is anatomically and physiologically correct, and I get isn't often talked about, right? So your pelvic floor, if I've got the bowl of my pelvis, it's kind of like the saran wrap muscular inside lining, right? If you've ever heard of Kegel exercises, this is that. The problem is a vast majority of people are hypertonic, meaning your pelvic floor is already too tight. We're already kind of holding everything in. And commonly, especially when we're talking about Kegel exercises, by practicing the tightening even more, we're just tightening up the system even more, which eventually exhausts the system. It's actually counterproductive. So I'm going to maybe reframe this. So here we go. In order to properly do a Kegel exercise, I'm not squeezing my butt cheeks. I'm not squeezing my belly. What I'm doing is I'm imagining, and here we go with some physiologic language, relax, yield, let go. And then in turn, imagine you want to stop the flow of urination. And then relax, yield, and let go. And then in turn, imagine you want to stop the flow of urination. And then relax, yield, let go. Contract again, and this time not only disrupting the flow of urination, but disrupting the flow of like you were going to pass gas, right? You got to kind of hold it in, which is very different than like squeezing your butt cheeks, right? It's like a more internal feel. And then more important is how much can I let that go? So that there's a squeeze And then there's a letting go. And there's a squeeze. And then there's a letting go. Now we can make it even more. Exhale, squeeze. Inhale, let go. Exhale, inhale. And there's a rhythm. And it's kind of hard to find sometimes. One more. And then just rock. Now, we're working our way up to like bigger gross movement, right? Which is like flexions and extensions and twists and side bends. But I would have been remiss not to give you the introduction we did a couple of weeks ago, the breathing exercises we did last week, and then some of the work we did this week, which is more targeted to lower body. And hopefully over the few weeks, you've learned some different stuff to kind of incorporate and get yourself primed for the bigger and bigger and bigger and bigger movements. So we'll end here for today. I'll stick around for whatever questions you got. Please join us on Friday. Bob says thank you. He's asleep as usual. But thank you. Thank you all so, so much. Looks like there are no questions for today. Bye for now, everybody.